Hi, my name is Mark Parker. I'm the Assistant Director of the Nursing Service here at Medical West Hospital. I've been an employee here with the hospital for 13 years, and I'm going to take this opportunity to talk to you for a few minutes about stroke. Just to give you some basic information about what a stroke is basically a sudden interruption in the blood flow to the brain. It can be caused by a number of different causes, one being a clot. That is called an ischemic stroke. The clot can be caused by a blood clot or by a plaque clot. A hemorrhagic stroke, on the other hand, is a stroke that's caused by a rupture of a blood vessel in the brain, where blood actually seeps out into the brain tissue. Both are emergent conditions and require prompt response on the part of the patient for us to have the best opportunity to minimize the risk of long-term residual effects from the stroke. There are also events that people may experience, some call mini strokes or TIAs. TIA stands for transient ischemic attack. The symptoms are identical. There's no way of knowing whether you're having an ischemic stroke or a TIA until you're evaluated in the hospital. Oftentimes the TIA symptoms will resolve within a relatively short time. Interventionally, there's not a lot to be done there except to monitor the patient and get them on a medication and lifestyle regimen that would minimize their risk of reoccurrence. But the symptoms are the same and should be responded to in the same way. Some people may be confused about the difference between a stroke and a heart attack. A stroke primarily is an interruption in the blood flow to the brain. On the other hand, a heart attack is an interruption of blood flow to the heart muscle. Symptoms are very, very different between the two. Some of the symptoms of a stroke are sudden intense headache, dizziness, confusion, an inability to say things that you would like to be able to say. You can't say the words that you want to say. Heart attack, on the other hand, tends to be associated with chest pain, crushing chest pain, pain into the neck, into the arm, or into the shoulder. Some experience back pain as well, but those are classic symptoms of heart attack. The most important thing for a person to do when they experience symptoms of a stroke is to call 911. Stay where you are and have an ambulance come and bring you to the hospital. The most frequent mistake people make is that they wait and hope that those symptoms might go away. What they need to understand is the longer they wait, the more brain tissue is dying and it will not regenerate. So it's important, as soon as those symptoms begin, to call 911, get to an emergency room, and let us begin to evaluate you and begin the treatment that is very, very time sensitive.